Hi, I'm Andrea. I'm a surgical tech. I work in the United States and I'm here to help show you how to reprocess your scopes. The first thing we're going to start off with is manually doing a bedside cleaning. For doing manual bedside cleaning, you need to have clean water or even a little bit of soapy water and a sponge to wipe the scope off with. I'm going to demonstrate how you would do that right now. So you would take the water and the sponge and just dip that down in there, get it decently wet. And what you're gonna start from is the handle of the scope up here and just kind of wipe around it. Wipe all this area. And you wanna kind of wipe down, being careful not to hit anything and damage the tip here or this area. And you're gonna wipe down the scope from this all the way around. An easy way to do is coil it up as you're wiping the scope down around here, and then come to the tip and carefully wipe the tip off here. After you wipe the tip off, you're going to insert this part into the water here, and you're going to push down on your suction button up here, and you're going to suction some water up into the scope until it runs clear down into the suction. From this, we will just take our scope off, finish wrapping it up, and in most places you will have a wrap to wrap the scope up to transport it to another spot. But if you don't, you can just coil it up just like this, and we will transport it into this room here. So when you come into the cleaning room, we want to gently set our scope down in here, not to hit it on anything or damage anything. When you bring your scope in, you need to make sure if it does have a cap that this cap is on completely so that it does not come off. When that scope is on there, some of you may have an endo flush, some will not, but I'm going to do it without the endo flush. Okay. So when you come in here, you will put the leak tester on here at this end. I'm going to set this part down in here. So the leak tester would go on just like this and just turn a little bit, and then you submerge that part down in here also. You want all this to be underwater, the best you can get it underwater, and then we will turn the leak tester on. And as the leak tester's on, we are going to check in here to make sure there's no bubbles in anywhere. By doing that, we will turn these knobs. A few little bubbles coming up is okay, it's just trapped air. And you're going to turn this knob back and forth. That will turn this area here, and you're really looking for bubbles through here, up in the scope, anywhere along it. So right now there's no bubbles, which that is good. So we'll turn the leak tester off. And then we will come down and take this part out of the water, unhook this off of here, and we'll set that over to the side. Then we'll put this whole scope down in the water, and we will add some enzymatic in here. Just a little bit, a couple of ounces. I will give the full measurement. Once that is in there, and the brush, and they have a brush on this one, the end. Some will be separated, there'll be two parts. The first thing we're going to do is we're going to take this end of the brush, and we're going to part this part of the scope right here, and you're going to take this in here, but you want to do it under the water just a couple of times, and then you're going to go through the suction biopsy port here and do the same thing a couple of times. After that, you're going to take it to the other end of the brush, and you're going to take this brush and you're going to go through the suction port here. The first part you're going to do is straight down, and as you take this brush straight down, it is going to go through here and end up in the umbilicus and come out this port here. So as you're doing it, you want to do short strokes that get everything clean, trying to keep it under the water as you're doing it. Once you get towards the end, you'll be able to feel that you're coming out this end here, and the brush will come out. You want that brush to look clean. If the brush doesn't look clean, you'll take it through a couple more times till the brush comes clean. Once you get to the end, you're going to slowly pull this back out the same short strokes as you went in the first time. After that, you're going to go back down this, but it's going to be at a 45-degree angle. So if you put it here and go down this way, it will take it down through this part of the scope that goes into the patient. The same thing, you want it back under the water, and push the brush in just short strokes all the way through. Once it gets to the end, find the end here, the brush will come out this tip here. Make sure if there's anything on it, wash it off. If not, let it go back out, and same thing, short strokes on the way back out. After you've washed this off with the brushes, then you will take a rag, clean rag with the stuff, and you want to start from this end, and you want to start wiping everything down. So make sure to get the cords all around these edges. As you're wiping it down, you can bring it up and kind of wrap it at the same time. That will help keep control of the scope. You want to get around this knob, being careful with the buttons up here. They're very easy to damage. So just kind of light, gentle rubbing on it. Make sure you get around all the edges. And as you're coming up, you can grab your hand here to help hold this and stabilize it. And then you want to take and rub your rag all the way down the insertion tube. That is cleaned in this water here. Once you have it cleaned in the water, you can take it over to another bucket if you have a clean bucket, or you can leave it in this water. What we will do from this water is take a syringe with the soapy water, and we're going to take this syringe and we will go down this section here and just squirt some water down through that. And that water is going through the whole scope. You could do it again a second time and take it down through the biopsy section also. There we go. We will take our scope back out of the water and we'll place it. After you've washed your scope and set it in the sink, take the same syringe that's empty and take clean water and fill your syringe with clean water. Then I want you to take the clean water, hold it over this area, and just push it through the scope. And do this a couple of times to make sure the water gets all the way through the scope with the clean water. After you've done the clean water, we're going to pick it up out of here, and we are going to take it carefully over to the disinfectant. The disinfectant, this needs to stay in here for a maximum of 15 minutes to be totally disinfected between each patient. So we're going to slowly lay it down in here. I'm going to grab a channel locking device. This will sit in here and slide on, and then you could put it through here and slide it on. They all have a syringe in here. So this syringe you're going to fill up with the solution, and you're going to push this solution through. You can either push it through here, or if you have a hose to this, you can push it through here. They do not have that, so I'm going to just pull this back off, and I'm going to push it through here as the same as the other one. Just carefully holding it there and doing it slowly so you do not spray yourself. What the goal is that you want this solution to be inside of the scope. so that it disinfects the inside of the scope also. So we'll push another one through here. And we'll let this set in here for 15 minutes. So when you take this out after 15 minutes, you will unhook this part and unhook this part if you have them hooked up, if you have this adapter. If you don't, it's okay, as long as this detergent is inside of here, the disinfectant. So when I take it out, I'm going to take it out by using the same method I do every time, and that's rolling it up. Part of this method is also to get any of the liquid out of the scope that is in there. As I'm doing, I'm taking care not to let anything bang around and care of the tips here. From this, I'm going to bring it back over to clean water in here and set it down in the clean water. From the clean water, I'm going to also suction up clean water again. And I want to rinse the clean water through this to get rid of any disinfectant in it. And just doing it a couple of times right through here. If you do have a hose that would attach to this, it would be better, or attach it to this edge from here, but we don't, so we'll just carefully inject water through the suction. After we've injected the water through the suction, we're going to take it out, the same thing again, winding the scope up. As we do this, you can see the water coming out. And then we're winding the scope up here. That is wound up here. We are also going to try to dry it out a little bit with air. We want this to be as dry as possible on the inside. If you do not have anything to put on here to manually dry it or process it, we can use a syringe to help get the water out of here. I'm going to stop for a second. Okay, for this step you want a rag that's dry, and you want a syringe that has air in it. What we're going to do with this syringe with air, we're just going to pop it up here and just push a little air through it for just a second to see if there's any water coming out anywhere. There is no water coming out anywhere on this. Another step to help dry it is take a syringe with some alcohol. And then suction it up with a syringe. And we'll lay this down here so that it absorbs the alcohol on here. You're going to take the alcohol and push it down through this, and that alcohol will help facilitate the drying. You don't need a whole lot because you can already see it coming out. So we'll push this back in here a couple of times so we have air back in our syringe. So we're going to just push the air back, and we're going to push air back in here a couple of times, which will push the alcohol out and help dry the inside a little bit manually. When you're doing this, use a little bit of force. You don't have to worry about it because there's just air. And you can see that force is pushing any alcohol out of here again. Do it a couple of different times. Once we have that done, we will take a clean rag over here that's dry, and we're going to dry the whole outside of this off. We're going to start from the top, coming around all the sides and getting in between all these little crevices. As we're doing it, we're winding that scope up again at the same time. Up here, we're going to get the handle, kind of come underneath the edges, being careful of these buttons up here again, because these buttons are very soft and they can come off you really easy. We're going to come down and keep drying the scope and wrapping it up at the same time, being careful at the very end of it. And once it's dry, then you need to hang it in the cabinet. When you hang it in a cabinet, the best way to hang it in a cabinet, hang it so that it stays clean in a cabinet, and it also stays protected in this cabinet. When we hang it, depending on what type of hangers you have, this one we just come up over here and we're going to hook it here. As we're hanging it, we're very carefully making sure that the ends do not bang, especially this end, it's very fragile, does not bang. And we're gonna hang it straight down like that until the next use. If you do not have a leak tester that is this type here, which is automated and does it for you, they have leak testers that look like this. So this end would hook to where I hooked that leak tester to, and you would pump this leak tester up high enough so you would be over here, and you would let it sit. Once you let it sit, you make sure there's no bubbles. Watch the gauge that it does not fall back down. If it falls back down, you usually will have a leak. If it does not fall down at all, you're fine. To release the pressure of the air that's inside the scope, we're going to push this button on the back. Hold it for about 5 seconds. That will release the pressure inside of the scope. When you release the pressure from inside the scope, you would detach this from the scope like we detached the other one. That means there's no leaks with the scope, and you can proceed with the scope washing it. If you also have manual air that can go through the scope, that's also better to physically dry the scope for 10 minutes on manual air. If you don't have manual air, at least try to get that scope as dry as you can by using a little bit of alcohol first and using the syringe several times to blow air through that, and then that will help dry the inside better. I hope you enjoy this video, and I hope it helps you in the future.